In what setting do you see immunotherapy being the most effective?
I think that what we've learned so far about how to treat these hematologic malignancies is that immunotherapy probably may be most effective when the disease burden is very low. Someone who has a lot of leukemia in their body, it may not be safe and it may not be effective to give an immune therapy, but someone who has just a small amount of leukemia in their body, immune therapy may allow their own immune system to clear that leukemia and provide longer responses rather than someone who has a lot of disease. So perhaps the post-transplant setting or someone who has what we call measurable residual disease. This could be different situations that could be more effective.
I think that and this is to some extent extrapolating from other diseases, because again, outside of a bone marrow transplant, immunotherapy right now is just very early, I would say, in most forms of acute myeloid leukemia. But in terms of where it can be the most effective, so first of all, again, bone marrow transplants I think of as a form of immunotherapy, and that's a key component of our curative therapy for many of our patients with acute myeloid leukemia. And bone marrow transplants are ideally best done when the patient's disease is under the best control. So it's a difficult kind of situation because from a patient perspective, if we are able to get them into a remission, ideally the leukemia blast cells are low, the good cells are back, they may actually be feeling pretty well. They may say, maybe I don't want this bone marrow transplant. Do I really want to pursue this? And actually, it's the time when they're feeling the best that actually is usually the time, if they're going to pursue a transplant, to do it. You want to pursue a transplant when the disease is at its absolute lowest levels and when the patient is doing the best. It can be very difficult to do transplants, and really even sometimes not even possible, if the patient is already going in very sick or if they have a very high level of disease going in. That just makes it very difficult for the transplant to go well. You worry about the disease just coming back very quickly. So immunotherapy in general, including bone marrow transplant, is really best done when the disease is at its lowest level. Thinking forward about things like CAR T cells, for example. We know from other data from, again, the different leukemia ALL, that CAR T cells work really well when the ALL cells are just at a low level, in the setting of very low level disease. And immunotherapies in general in other cancers often work well in low burden of disease. So I would imagine that may be a place where immunotherapy in the future for AML, hopefully could work well, maybe even to eradicate what we call minimal or measurable residual disease.